would have to be efficient. So to outdo that efficiency and tell me that I've got to buy a device for $2,000, I'm just making that up, of course, and then have recurring costs of, I don't know, $20, $30 for every patient, that's going to be a tough pill to swallow unless you can show me a massive uptake in my efficiency somehow.
Okay. I'm not sure what are you assuming for the recurring $20 or $30 cost? I know that's just an assumption, but what's that cost?
In the video I saw Peel Pack where there were syringes and things like that in there. So that would matter to me whether this device was the biggest capital outlay was in buying it and then no other cost thereafter, or if the capital outlay was in buying it and then a per patient cost because you have to buy a per patient disposable pack of some kind.
Okay. I think the Peel Pack was actually the pre-filled syringe of the drug with the screw-on cap. So I think that's basically would be cost of the drug. But at any rate...
okay. So basically what you're saying is that the only cost that you would have is buying the device. That's it.
Yes. Mm-hmm.
Okay.
Yeah.
Again, that's a if there are no recurring costs, that's a much lower bar. But then what I would have to know at that point is obviously it has to work and everything else. What is the cost of the device? And you would have to show me some kind of efficiency. But again, the bar is a lot lower for that than to have obviously a recurring cost per patient based on some kind of a pack or some kind of a thing you've got to clip on or something like that.
Right, got it. And so with the efficiency, you talked about it a bit earlier, and we never really did talk about time savings and whether they would allow you to see another patient or two or three. But if that were the case, well, why don't you tell me, would there be time savings, and how valuable would that be to you?
Well, again, it may not be necessarily valuable to everybody, but certainly would be valuable to me or people in a very busy practice like myself. If it allowed, if again, like I keep saying, if this device allows me to have a tech put one drop and me come in and pop this thing in, it certainly would save me a great deal of time with patients. And as long as it worked and as long as it was a single capital cost, it would be very attractive, especially if it was agnostic to any drug used.
Mm-hmm. Okay. And I'm just curious, because you did talk quite a bit about pain earlier on. If using this device allowed for a reduction in post-IVT pain versus what your patients are experiencing today, what are your thoughts there?
Well, again, because of what I do, as I told you, what I do is admittedly in the minority. What I've done is to make a conscious decision to sacrifice some efficiency to allow for more patient happiness. What the majority of my colleagues have done is not to make that make that compromise, which is perfectly fine. It's not good or bad; it's just what it is. And so, for me, if I can have the consistent knowledge that there will be no pain, and you will give me more efficiency, for me, it's going to be a huge bonus.
That's right, because you wouldn't have to do the sub-conj up front.
Right, and I wouldn't have to go back and forth. But again, I keep saying I'm in the minority, but remember, I do a sub-conj, I leave the room, see another patient, I come back, I inject. So it would save me a great deal of time if I didn't have to leave the room and come back and just did it at the same time.
Right. How much time? Is there a way to estimate that?
I would probably save at least 5 minutes per patient, which is a lot. That's a lot of time.
So would that allow you to book more patients in a day?
Yeah, or get out earlier.
Yep. that would be nice. Okay. What